welcome once again to Senior Focus. I'm your host, Bill Adams. Senior Focus is a show designed for folks over the age of about 50 or so. But of course, if you're younger than that, that's fine, because especially today, we've got a lot of information about your health and how you can take care of yourself. But before we get into the show, I want to thank Greg Roten, who is from Armstrong's Channel 20, who produces the show and makes sure you get to see it. And also Keith Kaiser. We come to you every time from the Davis Visitor Center here at beautiful Fellows Riverside Gardens in Mill Creek Metro Parks. And please come out and support the parks. There's much to do here all year round, and we really appreciate their help in producing the show as well. Today we're going to have Bridget Lackey. Bridget is with Humility of Mary Health Partners. Welcome.
Thank you.
And she's going to be talking about several programs designed to make sure, not only that you're well as far as going to see a doctor and specialists and things like that, but things that you can do on your own to give you better health. And this would apply, again, at any age, I think.
Any age, yes.
Well, at the top, and we'll repeat this later during the show, if people want to learn more about where you're at, the Health at Home and other programs, where can they reach you?
Definitely at our Community Health Education Department, and the phone number for that would be 330-480-3070.
Okay.
And all the programs are offered throughout the area.
Through both Trumbull and Mahoning?
Definitely.
Yeah.
At St. Joe's, at St. Elizabeth's, at St. Elizabeth Boardman.
What all is in the health education department? I mean, can you just talk about your
Sure.
role in it and then some of the other folks that are involved?
I'm a community health educator there, and we do some of the several programs that we'll be talking about. Also in community health education is our Resource Mothers program,
Okay.
which helps with young women that are pregnant either for the first time or it could be their second or third time, but they may need some transportation help, as well as learning parenting skills, just helping them through the whole process, and for 1 year after the baby's born.
Okay.
Some education there. We also have our Stepping Out program that we'll be talking about more. We also have our Hispanic, Latino, and Immigrant Health Department, and which helps them for Spanish-speaking people in the areas, provides different health education for them as well. And also then our Neighborhood Health Watch, which has different sites throughout the area, and many might be familiar with it at the different scope centers throughout Trumbull County. And at that time, a nurse, who's also a community health educator, goes out, will do some blood pressure screenings, some cholesterol and blood sugar finger stick screenings, again, throughout the area. And all these services are free. Everything is free,
Number one question.
And many of these programs are funded through the Humility Mary Health Foundation.
Okay, so that's a key funder for this, is the foundation?
Definitely, either between that foundation as well as then our Catholic Healthcare Partners. Okay. Because Humility of Mary is a part then of Catholic Healthcare Partners. Right. Which is headquartered in Cincinnati and throughout the state of Ohio, Indiana.
Now, I first met you at one of your programs that you run. It's called Health at Home.
Health at Home, and we have it highlighted for us right here. And basically, again, this is an all-free program. The main focus of Health at Home is to help you decide when is something a medical emergency and you need to seek medical advice ASAP, or when is it something that you can treat yourself at home. And as you know, Bill, whenever you attend, then you receive the great Health at Home book. And all participants would receive this book free. And with this, we kind of say that it's a cross between a self-care guide, medical dictionary, and first aid guide. Okay. That it'll walk you through, some common health problems, as well as helping you then to decide, as we said already, that when is something a medical emergency. Because what we've learned is that outcomes are better if they're treated right away. Right. In many instances, say for signs of stroke, heart attack, that you need to get to the hospital right away. Right. And so this kind of can help people with that. As well as then, when is it something that you can treat yourself? And offers then different guides for you to do that. Other sections in the book also talk to you about where do you get important information. you know, accurate information. Many of us, whenever we hear a diagnosis or that, first thing we do is Google. Okay, we check our phones, we check the internet,
Mm-hmm.
and face it that most of that information, or some of that information is not accurate.
Right.
So this gives us different websites and phone numbers that you can
Mm.
even contact them by phone with that.
So again, maybe the American Heart Association or the Diabetes Association. Yeah,
The Stroke Association, their numbers and websites would be in here where you can get accurate information, as well as for anxiety, depression, Alzheimer's.
yeah. Okay,
Okay, that information, Arthritis Foundation information is also in here. The program itself involves, you do need to call to pre-register.
okay.
You do not need, there's no fee, again, but we do like to know how many will be attending.
Sure.
And we rotate these throughout the valley at St. Joe's, St. Elizabeth Boardman, St. Elizabeth's on Belmont Avenue. And we have a schedule for you available with that. Program involves about a 20-minute video, and then we walk through the book. So all in all, it's about 45 minutes.
Okay.
In length.
And I did go through one of the programs, and one of the important things that you suggest to people is, like, for a doctor visit, for instance.
Yes.
If you're going to a doctor visit, you talk about planning ahead and writing down
Definitely.
questions you want to ask. Yeah.
Because we plan for everything. You know, I'm sure many of our watchers are planning already what they're having for Easter, you
Right.
know, and summer, and what they're going to go on vacation. And that. But one of the important things is whenever you visit your doctor. And I think we need to realize that, as educated as our doctors are, their best source of information is ourselves.
Right.
We need to provide them information. When did the problem start? What do you think it's associated with? What have you tried before? Because I believe it's, estimated that 70% of the correct diagnosis comes from what you tell your doctor.
Okay.
That it's not like Dr. Spock, where he can just, you know.
Yeah, there's some
touch-
gadget.
Yes,
Yeah,
yes,
right.
and, you know, look into your eyes and tell what's wrong. That you need to, you know, expand and tell the doctor. As well as then, especially if you're a healthcare provider for other people, you know, if you're part of the sandwich generation, or maybe a spouse, a good friend, family members, you know, that you're going to the doctor for, that you're the spokesperson for, to keep everything straight. It's,
Right.
you know, important that you write it down, and after the visit, too, that you write down, what did he say?
Right.
What test are
What's
you
the
having
follow-up?
done?
Yeah.
Exactly,
Well,
exactly.
and with so many people using medications too, I would think that really applies to, now, what pill am I supposed to take when, and what, you know?
Exactly,
Yeah.
exactly, and easily get confused. And another thing that we often mention in the class is disposing of outdated medications, to get
Okay.
rid of it. If your physician has changed your medication for whatever reason, don't keep it, you know, around, because then it's very easy to get confused.
Right,
Get rid of them. And we don't get rid of them the old-fashioned way, flushing them down the toilet anymore.
okay.
You can return them to your pharmacy, or oftentimes, you know, different police stations, fire stations throughout the area
They'll have
will take
disposal.
them back. Exactly.
Right.
But most pharmacies will.
Again, this is the Health at Home program, and
Yes.
and the book, now, again, there's no cost to that?
Correct, correct. It's all free. We have classes at 11 o'clock or at 5:30. So
Okay.
we can kind of catch, you know, if people are out working, summer will be coming, maybe they're busy during the day, later at night, and we have our schedule ready. Again, just give a call and get your reservation in.
Okay, so that's Health at Home.
That is Health at Home.
And I know you have another one that you're in the middle of, another series of programs.
Right.
It's about healthy eating?
And that's called Healthy Eating for You. And the main focus with that is we have so much information, again, out there. It's very difficult to juggle, okay, what's right, what's wrong. And as you happen to know, I am a dietitian by trade.
Okay.
And then became a community health educator. So, of course, looking at diets and the way people eat is very near and dear to my heart. And an important thing, too, is that whether you're looking for a diet for weight loss, heart disease, combating cancer, cancer prevention, diabetes, it's all kind of come down to the same basics right now. Portion control,
Okay,
reading those labels, and then too, examining why are you eating what you're eating. And those are the 3 classes that will be rotating. Now, these are held, again, out at Humility House, free of charge. We just ask that you do call that 480-3070 number to register.
okay.
And we will focus on each one of those topics. Classes start at 12:30, and we generally run till about 2,
Now,
right in the
could
community room.
we go a little bit in depth on some of those topics, the 3 that you,
Sure.
like portion control? what does that entail, and what do you talk about there?
Well, actually, with that one, we kind of try some different hands-on experiments with that. And what we're looking at is, we always talk about eating in moderation and eating a variety of foods. And many of us eat out.
Oh, yeah.
Especially many seniors there.
Yeah.
We've kind of earned the right to eat out, and we don't want to be cooking at home a lot. So then we need to learn, how can we eyeball how much we should eat? And we talk about it in a number of different ways. There's the small plate, large plate method.
Okay.
And definitely shown that if you're eating on a smaller plate, you tend to eat about 40% less
Wow, okay.
than what you do if you are
I mean,
eating
it's
on
just-
a large plate.
Right, just the size of the plate.
Just the size of
Okay.
the plate. And it's amazing. Many of the major institutions, there's people out there studying your eating habits like this for, years and years and years. Small study with that, I'll share with you, that I find amazing, is with the soup bowl, that they had people come in and, eating soup.
Sure.
Well, they were secretly feeding the amount of soup underneath so that the bowl never went empty.
Oh, yeah.
And I mean that some people were, eating a quart of soup
Oh,
before they
my.
finally realized that they were full. And that kind of gets into our mindfulness, but definitely the size does matter,
Okay.
of what you start with. And then the fact, too, that most of us make our plates kind of at the stove and then sit down, or if we're eating out, that no longer do we set the whole table with all the serving bowls and everything like that. But
Right.
again, if you're just starting with the smaller size plate, it can make a huge difference. We also get into, again, just how do you judge what you should be eating? And we kind of look at the hand method, that by the size of your fist, that should be your portion size for your
Okay.
starches, as well as fruits and vegetables. Because, there's so much out there about the need to eat more fruits and vegetables
Right.
on a daily basis. And then people are saying, oh, but I really don't like it. Well, you just have to eat the size of your fist.
Which is, the old method I heard was deck of cards.
Deck of cards for your
Similar,
meat
yeah.
portion, yes,
Right.
then that holds true too. But then people say, oh, I don't have it with me, I don't have the scales, things like that.
But,
that
yeah,
you
but you
can
could
judge.
judge, yeah,
You
just
can judge.
estimate, yeah.
And for the most part, we do know portion sizes.
Well, then the second topic you cover is label reading.
Yes.
And that's going to the shopping, grocery store. Yeah.
And definitely, well, we're kind of, rather than us all going, we kind of bring the trash to us and
Okay.
read then the labels, and we kind of divide everybody up as far as picking a good breakfast and that. And what was amazing with that is, I've been a dietitian for several years, but I learned something new with that too. When we talk about processed foods, what do you
Right.
think of processed foods?
Well, something comes in a box and it has a number of ingredients that you can't pronounce.
Easily. We think of like American cheese, Velveeta cheese, not to mention any names, but, and generally we say, the more moldable it is, the more processed. We think of
Okay.
ham, bacon, hot dogs.
Okay.
What about cereals? I'd never even really thought about that, with cereals being processed, especially all of the different, honey nut, yogurt in there, chocolate chip varieties, that the
Right.
sodium content, and watching sodium content is so important for many
Right.
of us, because over 70% of seniors have hypertension.
Oh.
So you need to watch that sodium content.
Right.
Shredded wheat has 0 milligrams of sodium. Some of those other processed cereals can have any much as 350 milligrams of sodium in a serving.
Right.
The other thing we learned there too is the difference of serving size versus portion size.
Right, and that's very tricky because, you'll see, the serving is only, it's 5 or 10% of my saturated fat or whatever, but the portion size that the serving size that they show is so small compared to what people normally eat.
Exactly. And there have been the recent stories about the changes in the food labels, and much of that relates back to that, that they're kind of unrealistic serving sizes
Right.
listed and information given. Now, important too to remember that those changes, we won't see those for several years, that they were proposed and then they're going to be debated for about the next 6 months. Then, again, they will decide how they're going to do it, and the companies will have about 2 years to roll it out.
Okay.
So we're not going to see any immediate changes with that. But again, then the importance of being able to look at an item and decipher then the information that is there. And you're exactly right. If you read down into that fine print, that sometimes you need a magnifying glass to read, but that if there's several listed there, then you can kind of indicate that it's definitely processed foods. So A+.
Sure. Thank you.
Yeah.
And then our third topic that you cover, one of the major topics, is eating mindfulness.
Yes.
And about your relationship with food, and I guess how emotion maybe goes into that.
And I really think that's so key, because so many of us, food is, what do we do when we've had a bad day? I deserve that chocolate, or,
Ice cream, yeah.
ice cream, yes. Or I just finished a, terrible project, or, we made it through winter, we need to celebrate, what have you.
Right.
As well as then, if it is a celebration,
Mm-hmm.
oh, what are we gonna eat? Let's have a party. Well, I'll bring, such and such in office parties or at home. Kids are coming home, what are we gonna have to eat? All the big things that we revolve around food. But also then, too, if we're having a bad day, for many of us, food is a comfort.
Right.
Food can be connected with memories,
Mm-hmm.
okay? That I remember, my aunt made this, or, we shared this, we
Yeah,
always went
grandma's house.
here.
Yeah.
Exactly,
Mhm.
exactly. Or if you visit somewhere, you have to have, go to the hot dog shop here, or have to have a
Right.
steak over here. So food and our emotions are quite tied. As well as, it just goes back to the whole mindfulness. Tim Ryan talks a lot about mindfulness too. Just being more aware.
Right.
And what we propose in that is that, again, you own the feelings associated with something. When was the last time that you actually felt hungry? I know. And two, then, when do you know when you're full? That many of us, again, it can be the size of the plate, the amount of time,
Right.
okay? Or when the show's over, you're done eating. If you sit and watch TV while you eat. So it's just being more aware. And really in there, we discourage people from multitasking while they eat.
Well, that's a good point, and you just mentioned TV. I would think, again, with seniors, I'm thinking, well, myself too, but if you're sitting in front of a television and you have a little tray or whatever, you're more likely, I would guess, to just continue eating more and more because you're just sitting there.
Exactly.
As opposed to having a designated, you go to the dining room table, kitchen table, and you got, 20 minutes, half an hour, you're going to eat, and then you're going to go do something else, right?
I'm smiling because I found my substitute teacher. See, if I can't make it, definitely you're on.
Okay.
And that's it, exactly, and that's what happens. And many times too, I'm asked, okay, well, what time should I stop eating at night? Is nighttime eating bad? And again, it's not, but it's the type of food we choose to eat at night
Right.
while we watch TV. Plus then, we kind of tend to go mindfulness, let's say, because we're watching TV, that bag of popcorn, if we bring like a bag of chips, box of cookies, Girl Scout cookies are out now.
Oh, yeah.
And you're just sitting there
One after
mindlessly
the other,
eating
yeah.
while you're watching TV. Or, driving in the car. We used to always say, whip through fast foods, then you're just, and then
Right.
when you find yourself digging in the bag and there's nothing there, that can be a sign then that, you're kind of doing it a little mindlessly.
Right.
And so just want to bring the attention back and say then, like after dinner, you want to get up, you feel like you need a snack. Are you hungry? Do you really need something? If you stand with the refrigerator doors open,
Right.
looking, and there's nothing in your refrigerator, chances are you're really not hungry, but that you're just,
filling the
bored.
time. Right,
Exactly.
right, yeah.
The need to chew. And then we talk a lot then too about, okay, once you've identified that, what are some tricks then that you can do? And definitely, if you find that you have a weakness for certain foods and they're not helping you reach your eating goals, whether it be watching the salt, the fats, what have you, then don't keep those foods around.
Right.
Keep them for special occasions, what have you. Don't keep the ice cream, even though it might be 3 for $10, you don't have to buy all 3.
Right.
Go out and get a treat, a cone, a
Yeah,
bowl.
once in a while, rather than every night.
Than having it right there, because if it's there, you're going to go to it.
Well, we can come back to some of these topics, but
Sure.
I know one of the events coming up that you want to talk about is the
Definitely.
Heart Day.
Women's Heart Day, and that's our great event, and we've had that for several years now, and that'll be May 8th.
Okay.
Down at the Cavelli Center, and that event starts at 6:30 in the morning until 2. A number of different vendors, we have speakers going on throughout the day.
Okay.
You can schedule to have your blood work drawn, and at that time they will be doing a hemoglobin A1C for diabetes, as well as a lipid panel for you free.
And that's free?
That's all free.
Okay.
They'll be doing bone density testing, blood pressure screenings, skin care screenings, skin cancer screenings. A number of different experts will be there talking all about women's health
Okay.
issues. And a number of different vendors also from the community will be there. And again, it's great, free. The number is on the screen, or you'll have the number for you to
Okay.
call, and they can get you hooked up, get your appointment scheduled for your blood work. Walk-ins are available, But it always helps if you're scheduled in.
Yeah,
Without
and,
a
and
great event.
that answers one of the questions. You talked about it's open from 6:30 in the morning till 2, and I was thinking
Yes.
6:30 in the morning, but if you're doing the fasting
Right,
blood
right, because
test,
you do want to fast
Right.
12 hours
sure, that would be
to
good.
get a more accurate reading on
yeah,
your
to come in early.
results.
Yeah,
And
before-
we have breakfast. We'll have breakfast
Oh, you
for you
do?
there.
Okay.
Yes.
So you can
Yes.
get the blood work done and then eat.
And you don't
Yeah,
have to worry about
okay.
week. And then they'll have different fitness instructors there also,
Oh.
so that you can partake in that. Again, a great event. Mainly focuses, again, on the heart, but all of women's health issues that are so important.
Yeah, I guess that's been sort of ignored a lot is, we think about men and heart disease and things like that, but women
Definitely.
have the same issues, the same problems.
They have the same issues, but they can present themselves very differently, especially like the, warning signs for heart attack are very different in a woman than they are in a man. Men, kind of get that clenching chest pain,
Right.
where a woman might have, a sweat, a pain more in the back, kind of a nauseated feeling.
Okay.
Oftentimes she ignores because she's busy taking care of others.
Right, right.
So that's the main focus, and that's why we are separating. Gentlemen are welcome, but it's mainly focused for women.
Maybe to
As
give-
an escort. to
give
their
someone a
women.
ride,
Yes,
right, or-
definitely,
yeah, right.
definitely, or to
And
get
encourage,
around.
or encourage them to
That's
come.
great.
Yeah.
For sure, and we oftentimes need that encouragement
Sure.
throughout.
So that's the
Yes.
Women's Heart Day on May 8th.
Right.
And again, going back to the Stepping Out program, that's
yes.
really interesting to me.
And this is a great exercise program that we have through Humility of Mary that we offer. And a number of sites, we just branched out to Warren this year. So
Okay.
we're very excited about that. Again, all free. So if you've ever thought about trying Zumba,
Oh.
line dancing, chair aerobics, core strengthening, we've got you covered. Free of charge. There's also a health screening associated with that. So you can come in, have your blood pressure checked, your height, your weight, and they'll continue to monitor that monthly for you if you
Wow.
so desire, as well as your body mass index and body fat, percentage of body fat. So you can judge all those things and track those things for yourself, free of charge. This program started in 2009. We have last year over 600 people enrolled in it, and just great.
Yeah,
And
I'd say, those are the folks that are pretty much ahead of the curve. They're doing what they
Definitely.
should do, especially as you get older.
Definitely.
You
And-
you want to be more active.
there's people in their 80s
Wow.
that are out there. So, again, if you've ever thought about it and thought, oh, gee, I don't really want to go, the gym membership or that, give us a call at that 480-3070, and we can hook you up with Tasha Fields, that's in charge of that program, and, tell you what's happening at what site and what times. They also do cooking demonstrations.
Oh,
So
okay.
to help people then, trying to make the whole change, mind, body, spirit there. So if you need to look at, different things to prepare, recipes, cover it all.
Now the whole point of what we've been talking about, again, health education through Humility of Mary Health Partners, and I'm just trying to think, well, this is free and the foundation helps. What's in it for the hospital system? And well, it can't. I guess the answer is better health outcomes, I would suppose, right?
Healthier, yes, for our, the health of the valley is very important, humility. Part of our mission is to help serve the underserved and the poor, and just to, make sure that everybody has access throughout the valley, and again, like you said, spreading the word. Okay, that we want to be more out there for the health. Definitely, our facilities will be there to treat in an acute,
Sure.
or a trauma case and that. But, many instances then, the lifelong, treatment is to continue watching what you're eating, better health, as well as then with Women's Heart Day, we need to, discover issues. And many people then, who might not have a doctor, or maybe they're looking at this more as a social event and they just happen to get out there, but we are finding many diagnoses at that time too.
And one of the things, unfortunately, was in the paper recently was the standing of our two counties statewide. And I think some of that is a function of maybe income too. I think if folks don't have the income to maybe, go to, they talk about food deserts in certain parts of a city and that just means you can't get ready access to a good grocery store. and, and exercise programs. Again, I think if people are lower income, they say, well, I can't join a health club, I
Right,
can't do it.
right.
But anyway, that just came out about
And
the,
yes, definitely, and funny you'd mention then with the food deserts, because Humility of Mary has been partnered with Lake to River Food Co-op about the last 4 years
Okay.
in providing markets in the food deserts. St. Elizabeth's is definitely a designated area as a food desert, and monthly, the Lake to River Food Co-op will bring a variety of different farmers to the hospital.
Oh.
And it's open to the public,
Okay.
to the employees and to the public, as well as then at the square in downtown Warren, Courthouse Square, we'll have monthly farmers. And
So
you can
it's,
check our
fresh
websites.
produce and
Fresh produce,
vegetable.
all locally grown. So you're not only, getting the freshest available, but also helping the local economy.
Right.
Through another grant that Humility Mary has funded for us, as well as Catholic Healthcare Partners, last year we started the fruit and vegetable prescription program.
Oh, okay.
And this is where physicians in our ambulatory care centers, family practice areas, the Todd Avenue Community Care Center, physicians there are actually writing for their patients prescriptions for fruits and vegetables.
Okay.
They take that prescription to the markets that we host, and they're able to shop then and get a variety of fresh fruits and vegetables, as well as talk with the farmers. We have different educational sessions
Right.
that are going on at that time as well. Markets will be starting up again in June, and they'll run through October.
Oh, good.
And so, so that perfect
Well,
segue.
that's the idea of the prescription for fruits and vegetables. I mean, that makes sense. Again, if you're somebody suffering from high blood pressure or
Definitely.
diabetes, those are
Definitely.
the things that you really need to concentrate on.
All of us, What's one of the first
Or to
things that they
prevent,
tell
yeah.
you? Definitely,
Right,
to make sure you're eating your fruits and vegetables, the whole
Right.
plant-based diet too. And definitely shown that, many of our diseases that we're faced here in the valley, 70% of those could be avoided. Not just treated, but avoided if through lifestyle changes.
Right.
And that with that survey that was out there about, the health of our valley.
Now, speaking of, I mentioned diabetes, is that part of also the health outreach?
It's part of our umbrella.
Yeah, okay.
Community health education is part of community outreach, and diabetes education is also part of that.
Right.
The WIC program in Trumbull County is also associated with that, as well as our prescription assistance
Oh, good,
program
yeah.
is also available through community outreach, which are all under the umbrella.
And again, prescription assistance for Mahoning County, that's through St. Elizabeth on Belmont.
Yes, and we also for Trumbull County, and that's out there too at the Todd Avenue.
Okay.
Minor care, corporate care complex near the old St. Joe's.
Okay,
For
and
people
that's,
that are familiar with that area.
yeah, designed for folks who need help with getting
Certain
prescriptions.
prescriptions, definitely,
Well,
definitely.
well, thank you very much. We've been talking with Bridget Lackey. Bridget is with Humility of Mary Health Partners, their community outreach, their health education program, and hopefully you'll attend one or several of these programs that are available. Well, the Women's Heart Day is going to be in May, but the other ones are on a regular basis, so we encourage you to go out and participate.
Sure.
And again, you've been watching Senior Focus. I'm your host, Bill Adams. We come to you through Channel 20 at Armstrong Cable, and thank you to Greg Roten. And also thanks to Keith Kaiser from Mill Creek Metro Parks, who allows us to use the beautiful Davis Visitor Center. So until next time, thanks for watching.